Okay, so hello everyone. This is Shilpa here, and today I have the pleasure of interviewing Jane Lindsay. She's a dedicated homeopathic practitioner who has been instrumental in spearheading, I would say, the homeopathic project in the Solomon Islands. Now, with a passion for holistic healthcare and a commitment to making a positive impact on the community, she's been involved in training local islanders in the principles and practice of homeopathy. And her journey began sort of with this deep seated desire to bring accessible healthcare solutions to the underserved communities. And now she is on her way to go to the next level. So she's seeking additional volunteers to join in this noble endeavor. And today she'll be sharing her personal experiences, her insights, her aspirations for the future of this project. So lots to decode here. So welcome, Jane.
Thank you, Shilpa.
Share with us, right from the beginning, your journey into what inspired you to start onto this project. Solomon Islands, how did it come about?
Well, we'd just arrived in Australia in 2009. Life was exceptionally busy, but an email arrived in my inbox from the then treasurer of the South Seas Evangelical Church, Ken Taylor, requesting support for the water medicine of the Solomon Islands, first introduced by Christian missionaries over 100 years ago. Ken and his wife Shirley had been stationed in the Solomons for a number of years and wanted to really seek some assistance in assessing whether this water medicine everybody was using was correctly being administered, and to provide some training and support for the 150 dispensers across the islands of the Solomons. So this is an amazing legacy that goes back a very, very long time, that's provided primary health care for thousands of villages for over a century, and one that must and needs to continue.
So, Jane, you've been there before and you've sort of been in touch 10 years ago, I would say. So tell me, when you went there for the very first time, what challenges did you encounter and what have you been, doing all this way?
Absolutely. Well, initially we met with the members of the church in Honiara, but it was the language barrier with the dispensers, because the dispensers' local language is Pidgin. So we had to have an interpreter. And that was fine. They had actually learnt knowledge of the materia medica, as we would call it, or the homeopathic remedies, by numbers. So it's actually called homeopathy by numbers. They refer to it as the water medicine. But it's that they've learnt that if somebody comes with diarrhea, for example, and it's hot, they need number 22, belly run hot. And that's arsenicum album. If they come and there's been an accident and they're in shock, they get number 1, guess what? Aconite. A woman who comes in labour, whose labour is not progressing well, they'll get slippery birth. Slippery birth, have a guess? Colophyllum, or colophyllum, as they say here, number 21. So through the interpreters, we were able to ask questions for dispensers, both in Honiara and on the island of Maleta, to establish how they dispense, what sort of illnesses they're dispensing for. And we were just blown over by the fact that it wasn't just coughs and colds and cuts and bites and itches and rashes, but people who had diabetes, who had blood pressure issues, who had some really severe chronic illnesses, were being supported by these humble village dispensers, the village pastors of these island communities, by numbers. And I just thought this was amazing, absolutely incredible.
What was the impact? What was the effect of these so-called medicine by numbers?
Well, the medicine by numbers, or the water medicine of the Solomon Islands, has been primary healthcare for over 120 years now, absolutely fundamental to the health and well-being of communities across these remote and rural villages on the islands. Without this medicine, there would be nothing, no healthcare provision whatsoever. The medicine, the homeopathic water medicine, is trusted, it's asked for by everyone. Even the hospital pharmacist in Honiara was sending patients post-operatively to the church dispensary for medicines post-op. And indeed, the pharmacist then, in 2010, attended our training workshops.
So, we connected through the Palgar Solomon Island sort of collaboration, and I realize you are making your next trip to the island. So what is it that you are, looking at in this visit that you'll be making in October?
Okay, so for this October visit, we've got a team, but we need more people. We need fresh, young, new blood, dynamic, willing homeopaths with energy and enthusiasm to carry the project forward into, well, the next century even. Leadership of the team moving forward, facilitation of training, further auditing of what's going on within the villages, and record keeping, which they're not great at. And we're adapting the handbook to homeopathy by numbers, which hasn't been updated since 1960 something, as well as making individual remedy kits. So at the moment, there are main dispensing kits across 3 islands, which means it can be several days before some of the villages can access remedies. So each of the 50 dispensers that attend our workshops in October will go away with a kit of 56 remedies. So that they can actually commence prescribing accurately, and they'll get a copy of this updated handbook. So we've got a very, very busy 4 or 5 months coming up.
Wonderful. So, talk about how do you train these people, these islanders? You have an interpreter in between, but how does that process go?
Well, this year, the training will take place across a week or 2 in October. So we're taking the team out on the Saturday prior. There'll be a week of training the dispensers. How we see that day formatting is that this time we will be able to use digital projection to illustrate the remedies and to put forward information and to back up the handbook. And then in the afternoons, we want to split the dispensers into groups of 8 or 10 and have one homeopath with each of those. So that must be 6, 7, maybe 8 homeopaths having smaller teams to go through case studies, to talk about the type of people and type of illnesses that they've been treating. They may not know the names of them, but they know the symptoms. So there'll be a basic understanding of the materia medica put across, but also last time we showed them how to take blood pressure. We did tongue and nail analysis. General health and hygiene in these kind of communities is super important. If someone gets a cut or a graze, the type of things they're exposed to, it can very quickly get very, very septic, and wounds get infected very, very easily. So preventative things in terms of health and hygiene is important. The second week, we would like to commence a train the trainer program. So in that first week, we hope to identify those dispensers who have a better command of English, who have a broader understanding of materia medica and homeopathy, and who will be suitable for us to start some training, to train them as trainers, to help with the ongoing facilitation of improving knowledge and case sharing with the other dispensers. When we went 10 years ago, a lot of the dispensers were in their 70s and 80s. Some of them are not there anymore. So there is new, young, fresh blood coming through. And therefore, we know the levels of literacy have improved. And we also know that there is now Wi-Fi and mobile phones on the island, which, yes, provides an environmental issue, but it also gives us huge potential in terms of ongoing training and contact with the islands.
Got you. So when volunteers are applying, what are the qualities that you are seeking? What skills should they have?
Well, clearly a passion for homeopathy and a passion for people, an understanding of our materia medica, but more importantly, an ability to put this across, and the concepts and history and philosophy of homeopathy in a fun and informative manner, to an audience, that is quite different perhaps from your average homeopathy for the home course that we run here in Australia. The day-to-day living and the conditions is different, obviously. But yeah, passionate people that want to help others, basically.
Perfect. So any practitioner, any camp practitioner using homeopathy, or even a lay practitioner who is passionate about homeopathy but has been in practice, that would be an ideal candidate for your project?
Absolutely. Anyone who has some experience of homeopathy and a heart for helping people. We've recently heard from someone here in Australia, I think in Brisbane actually, whose husband originally is from Guadalcanal, which is the island of where Honiara is the capital. And she's just done a basic first aid and fertility course and wants to come across and help his people. So anybody from any background, you don't have to have been a homeopath for 25 years like myself. We actually want anybody that can commit to this.
With a passion to just help.
Yeah. Absolutely.
So, this is wonderful, Jane. So, after looking forward, taking this whole process forward, say in, 2 years' time, 3 years' time, where do you see the future of this project in the islands? Ideally, if you had a magic wand, what role do you see your project and your volunteers playing in this project?
Again, a really fundamental role in assisting them to become self-sufficient. So running, yes, digitally exchanging information, case studies, workshops, in the manner that we do anyway, to
Correct.
give the support and to help with the understanding of chronic disease and the patterns that they're seeing there, in order that, the future of this amazing legacy continues, not just for the next 100 years, but thousands of years, to get them to be self-sufficient, much as other homeopaths have done in other parts of the world. They've gone in, they've helped, they've supported. We think of Jeremy and Camilla in particular. Now they have trained and graduated their own people to become village dispensers. And that means that more people get seen, more people get helped, and their health improves and they get better. Yeah.
Perfect. So, is there anything that you would like to share with the potential volunteers about this project, or what can they expect when they're working with you, or the experiences in the islands?
Well, firstly, if they're interested, please just get in touch. Just do it, as the Nike phrase says. The Solomon Island people need you. Your experience and knowledge will be so appreciated. It's an interesting place to visit, extraordinary people, and to see firsthand how medicine by numbers has supported acute and chronic disease simply and effectively for over 120 years is a unique experience. And I doubt that actually you'll see it to this level anywhere else in the world. So please get in touch.
Thank you very much, Jane. So how can people get in touch with you? What do they need to do? What's the next step?
Next step would be to email me, and then we'll set up a time to have a chat about their experience, why they're interested, what they feel they can contribute. My email is very simple. It's Jane, plain Jane, no fancy bits, at Jane Lindsay, that's Lindsay with an I and say.com.au. And there is a little bit about the project somewhere on the website as well, I think on the front page. Yeah.
Perfect. So even below this video, I'll be sharing your details and your website so people can get in touch with you. So any parting words, any, passionate words that you have, going forward from here?
Wow. Well, it just bowled me over to go to the Solomons and to see that our medicine has been so effectively used over such a long period of time with so little input, and the passion from these people and their interest and their trust that this medicine works. There's no placebo effect. They use it for themselves, their animals. Even there is a permaculture farm in Maleta that I think was using homeopathy on the land, and that was 10 years ago, rather, not 100 years ago, run by a Japanese NGO. So really interesting place to visit at this point in time and in history. And if you have a passion for people, a passion for travel and different cultures, then please join us.
Very much. Thank you so much, Jane. Thank you for the work that you're doing and, for spreading this wonderful science amongst these islanders, and they've been doing it. It's just about sustaining and, nurturing them further so that they can take it to the next level. But thank you so much for doing this.
Well, thank you, Shilpa, for sharing this with a broader community. And we look forward to reporting back on how it all goes and what happens next.
Very much. We'll keep you updated on how this project turns and, get you those little tips and things about what's going to happen in the future. But this is great. This is an exciting journey, and we all want you all to be a part of this. Thank you.
Thank you.